Okay, so first and foremost, one of the questions we wanted to ask was, a lot of people will assume, again, we should never assume, but assume that they can't stay on their medications during pregnancy. What would your response to that be?
So my response is stay on the treatments that are most effective for that person. It's an individual decision. So some people may decide, oh, well, I would really prefer to be off treatment. I'm going to work with my therapist and see her or him regularly to stay well. But if we know that the antidepressant that is utilized to manage anxiety and depression has been so effective for years, people feel much worse, they get severe symptoms off of it. We have a ton of reassuring risk benefit information on the antidepressants that provide reassurance that we can have people stay on treatments during pregnancy and postpartum to mitigate and prevent depression in pregnancy and postpartum. So absolutely, there's plenty of information to provide reassurance for that. The other thing to keep in mind is that our bodies change. The physiology of ladies or people who are pregnant change. And for the most part, sometimes the antidepressant dosing might need to go up. Or stay the same. We try not to back off. We really want people to stay on the dose that works for them. But also know that if sometimes symptoms seem to creep in pregnancy, see the clinician, see the person who's prescribing the medication, and consider a dose adjustment. It's possible that because of the changes in pregnancy, the dose need might go up.
Which is, again, Mom, and you were saying because of the liver potentially work. Is that mostly related to the liver working? Describe that for me, how you were saying that.
Yeah, so the liver enzymes sometimes are like the hormones related to pregnancy can actually induce and make the liver function a little bit faster and cause the liver enzymes that are utilized to get rid of toxin and other medications in our system may actually cause the medications to leave our system faster. And because of this, the dosing of treatments might go up.
Okay. I mean, I think that's so interesting. People may not realize that. And again, would you say that there's any, there's so many different medications out there. And one of the things that the midwife also talked about was having maybe a preconception talk. If you're thinking, that's sort of the ideal situation, right? If you're thinking about getting pregnant, have some of these conversations before, so you have your expectations set on what you can stay on, what you might want to consider changing, that type of thing.
Exactly. So try to do this beforehand. We have, clinicians, and so we have plenty of clinicians, whether it's in psychiatry, mental health, or maternal fetal medicine with our midwives to provide some guidance on making some decisions before, in preparation.
That's the perfect world. But if you are pregnant, stay on your medications until you can have that conversation. That's kind of what I understand is sort of you don't want to mess with your mental health because your physical health is going to be changing, the physiology. So you don't want to if you found something that works for you, stay that course until you can have that conversation.
Absolutely. So we want to encourage people to not stop treatments abruptly. If they do have that preference, then it should be done gradually under, guidance from the person who has that expertise. But try not to stop things abruptly because then the anxiety and depression can come back full force. And it might be a little bit more harder to manage. Also know that there are plenty of non-drug treatment options, but if it works in favor for that person, we really want to keep that balance.
Okay. So I think that's really the important message. Well, obviously you're concerned for the baby and the physical health of the baby. Mental health matters just as much going through, especially such a life-changing experience as pregnancy.
It's intertwined. So the physical and the mental work together real well. Sometimes people who have anxiety and depression may be at slightly higher risk for some things like preterm delivery. They may be at risk for things like, hypertension in pregnancy or preeclampsia, glucose intolerance or, gestational diabetes. Our motivation is to try to help people stay well, to mitigate some of the additional stress load from untreated conditions like this. And by doing so, our hope is we can help people have a healthy pregnancy, and
And a healthy baby down
prevent
the
some of the
line.
healthy
So,
babies
so
down
I
the line,
guess,
prevent complications. Yeah.
so the last question is, and I've heard stories of people, it can take a little bit to find the right dosage, the right medication that works for them if they're suffering from, depression or anxiety. And, you would hate for someone, I mean, if you had cases of people who are like, gosh, it took me 2 years and I finally got this right. Now I can't get pregnant, I can't go out. I mean, they're not mutually exclusive, correct? Like they can coexist.
So it can coexist. And so when people, for example, develop the new onset of depression or anxiety while pregnant, that can happen too. We usually would encourage people to have a conversation with family members, whether it's their mom, their sibling, their sister. If they've had experiences with treatment, even brothers or fathers, find out if they have been on treatment and what had worked for them, what had not, and make a decision, really informed by what their family members have experienced. But that could really help sort of like expedite their decision, finding the right treatment for them. Like I said, there are also, for example, I really respect, folks who also prefer non-medication options. And so in our clinic, we have done a fair amount of work, and intriguingly, bright light therapy, you may not have heard of it or heard of it as being used for purely seasonal affective disorder or winter depression. Bright light therapy can also be very effective for managing perinatal depression. It's a non-drug treatment option to consider. Lauren is like, oh, what is that?
No, I know what it is. Yeah, it's
So,
like when you
yeah,
use
oh,
the light, yes, for like
yes,
30 minutes. Yeah, I mean, oh
yes,
no, I
exactly.
know exactly what it is.
Oh, great.
I never
Sorry.
thought of it
Yes.
as a treatment, during pregnancy, but you're right. Like that could work.
Yes, and clinical studies have been done, and they've been repeated or replicated and shown to be a promising option for people who are interested in non-drug. And also, I really want to emphasize, psychotherapies, see your clinician, get referred, can be very helpful.
So there's lots of options out there. So
Yeah,
again, you don't have
exactly.
to put aside your mental health to have a baby. I know just in my research that, mental health medications have become, really predominant, especially, during the pandemic and all those things.
Yes.
Is this one of the first things you ask women that are you on one of these medications, that type of thing?
Yeah. So when people come to us for the first time with their pregnancies, we review all the medications they're on. And it's pretty common for people to be on things that are not even on their med list. So we go over supplements as well. And there's a lot of medications that women are on that they don't even know interact. So we go over all of it. That's one of the first things we go through. But it's really nice to have them come see us before they're even pregnant. That would be the best way to do it. So we can discuss all of it before we're talking about how it affects the pregnancy.
Because I was going to ask, are there any medications that we know of, that when a woman is trying to get pregnant, especially again from the mental health perspective, that they should
Right.
avoid?
There aren't too many hard and fast rules. So the medications that would cause severe problems with the baby are most of the time not even prescribed for women of childbearing age. It's really more about weighing the pros and cons of all medications, talking about the risks. So, for example, there's some medications who the studies are not clear about exactly how they will affect the baby. So we talk about, okay, well, this is what the studies do say. And it wouldn't make sense for us to do large studies on pregnant women. So the studies that we do have are looking back at how women did and how their babies did with those medications. So we really can't say much about the newer medications, for example. Some of the newer meds that are related to the tried and true ones, that the newest stuff on the market, we don't have a lot of research on. So all we can really say is this is what we know about related medications, but these are your risk factors. So for women who have pretty severe mental illnesses, I wouldn't want to mess with their medications because we want them to survive the pregnancy, and their mental health stability is really important.
That's what I find so fascinating too, right? I mean, I have friends and anecdotally I've heard stories about it takes a while sometimes to find
Yes.
the right dose, the right medication. So if anyone is saying, but I finally found the right medication, I can't get pregnant now. Is that
Mhm.
not true? Is that false?
Yeah, absolutely. That's not true. So in the absolute perfect world, I would love to have these conversations before women are pregnant and to put their mind at ease And also in the perfect world, we would like to be working with everyone on their team. So I try to think of it as the woman is in the driver's seat. She's the one who gets to make all the decisions about what's going to happen with her pregnancy. But we're kind of like the navigators, helping her to find what is best for her specific situation, because what works for one woman won't work for another. If a woman took years to find the right combination of medications, if she has a complicated mood disorder, I don't want to take her off the medications that are keeping her alive. So, and she deserves to start a family as well. So if she is stable with the medication she's using, I want to work with her. I want to work with her psychiatrist. I want to work with her counselor. I want all of us to work together to find what is the safest way for this woman to have a baby, to have a successful pregnancy, and to not just survive it, but to thrive during all of it. And it takes a team.
And it sounds a little bit like, women, we always talk to each other, right? Like, oh, I did this, or oh, I tried that and it was great. I mean, or everything, right? From food,
Yes.
like clothes to,
Yeah.
whatever. So, but this is an example of like, sometimes you can't listen to what your friends are saying. You need to go,
Yes.
it's an individualized approach. That seems to be the key takeaway.
Very much so. And I'm sure, as you know, the internet is a dangerous place. If you go on there, you're going to find all kinds of conflicting information, right? You're going to find really old studies or really old ways, and you can't rely on it, because if you go looking for what you want to find, you're going to find it on the internet. So it's so much better to go to your provider and have this discussion and say, look, I've read online that this is dangerous. And we can say, yes, and there is some risk with this medication, but you going off your medication is an incredible risk. So we need to weigh the pros and cons of everything you're on and decide, is this what's best for you and for this baby?
So it's really, again, talk to your provider and don't make any, if you all of a sudden say with your partner, like, let's try to get pregnant, I'm going to go off my
Mhm.
medication. That
No, no.
is probably a no-no too,
Yes,
right?
please don't. Yes, please don't. Especially, if you have been stable on the same medication for a considerable amount of time and your mental health is doing really well. I see it all the time. I'll see women will, they'll find information or online, or just logically they're thinking, well, there might be a risk to this medication. And so I want to do what's best for my baby. So I'm just going to stop taking the medication. And then they see me, and it takes a little while for them to withdraw from the medication. Then they get pregnant. And then a few weeks in, they're not feeling well and they're really nauseous and they're vomiting all the time. And then their mental health is decreasing. And then we're just a mess. So it's much better to stay on your medications. If you haven't met with somebody for what's called a preconception visit, which is when you discuss what you're on and then we make a plan. If you just are pregnant and you're seeing me when you're already pregnant, and you're already on your medications, I just want you to stay on them until we have that discussion, because it's much better for us to have this, what we call shared decision making. So we have to share what we know about you. I'm kind of the expert on pregnancy, and you're the expert on your body, and we work together to find out what's best for you.
I mean, there's so many things, again, and I have 3 kids, right? There's so many things
Same.
again that I didn't think of, even,
No.
when all of this came around. So
Yeah.
hopefully this will highlight for people, again, just sort of that, like thought provoking, right?
Mhm.
Is there anything that we haven't talked about that you would want people to know about this decision-making process, about what your advice would be?
Um, I guess, well, one of the things that midwives bring to the table that I think is really great is we have built into our schedules to spend a little more time with patients, and we focus a lot on mental health. So I try to come up with new and interesting and different ways of asking the same questions to get women to open up and spend a little bit longer with them, because we feel like the mental health aspect is just as important as every other aspect, right? We measure your belly and we listen to the baby, but your mental health really matters. And women need to talk more about how difficult it is. Pregnancy is hard. And I know online it talks about, things are great. And on social media, everything looks perfect, but it's really hard. And women should have space to talk about that.
That is the advice I tell people all the time. One of my younger colleagues, when they're pregnant, I was like, give yourself grace. You are about
Yes.
to endure something that, you know what I mean, is just
Mhm.
miraculous, but also challenging. So give
Agree.
yourself some grace.